Okay, the hip flexor stretch. If you've been prescribed this exercise, it's probably highlighted on the list of things not to forget to do. The hip flexor stretch is critical for people that typically sit all day and have shortening of the muscles in the front of the hips, the hip flexors. The hip flexors, the muscles here, typically cause you to flex the leg. Now typically when you sit for hours and hours, for days and years on end, these muscles are going to have a very strong tendency to actually get shorter on you. And that's a dangerous thing because you're going to find yourself after a decade of desk work standing up and you actually can't stand up all the way anymore because these muscles are just too tight. Some of you know these are tight. Some of you, we've had to tell you that. But we need to stretch these out and lengthen these muscles again and keep them lengthened out so you can maintain a normal erect posture as you age. So here's how you stretch these. They can be done standing or with supports at home. I'll show you both. The standing hip flexor stretch sometimes looks just like this. Again, we're trying to stretch out the left hip flexor. So we got a little bit of a bend in the knee. We're keeping a very vertical posture, almost leaning back a little bit. You'll notice that if you tighten your butt and lean back a little bit, you feel this stretch increase significantly. And again, as you can see, we're just lengthening all this muscle that's actually grown tight or short over time. Okay? Now, that's the basic stuff. I have a preference for this. I like to do mine down on the floor at home. And we're going to stretch out the left hip flexor. I like to have a support chair, an ottoman, things that I can lean onto, etc. You don't have to. But you're going to stay vertical and then just simply lean forward and you'll feel that stretch in your hip flexor. Okay? Let me show it from this angle. Stretching out the left one, we're just going to simply lean forward, stretch that all out, and lean back perhaps a little bit. Now here's another thing. We can't just stretch one line or one angle or one portion of this muscle. We're going to stretch out multiple portions of this muscle. So we want to stretch out not just the front of the hip flexor, but we're going to stretch out the front inside and the front outside of the muscle. And here's how that looks. Getting in this position, you can simply rotate your hips and you rotate the stretch to the inside of your body. You can hold that for a few deep breaths. You can go back to the middle front and then you can rotate and twist. And this is where it helps to hang on to something, but you can twist and get the outside of the hip flexor as well. I prefer to do it the latter method. It's much more well balanced. It's a much better stretching protocol than just doing the quick and calling it a day. Yes? Okay, so that's the basic hip stretch protocol. If you have any questions or have any problems, ask somebody here to demonstrate and help you find the stretch. As far as frequency and how long you should hold it, again, 2, 3, 5 deep breaths, or 5, 10, 15, 20, 30 seconds is preferred. You can also check your home care prescription sheet, and how often you should be performing this, which is pretty much daily, is going to be listed there. Again, if you have questions, please ask. That's the basic and the advanced hip stretch or hip flexor protocol.